I'm so sorry.
Just sitting here wondering what I should do for my microbiology final project. As I sit here, what is that? I think I see a deer in our living room. Let's get closer and investigate. I believe that is a deer. Look at that. What is that on the deer? I believe that's a deer tick. This appears to be the black-legged tick, commonly called deer tick, or the Ixodes scapularis. The life cycle of this black-legged tick comprises 3 growth stages: the larvae, the nymph, and the adult. Here we have an actual nymph in the middle, the female and the male deer ticks. Since we had a deer tick invading our home, oh, honey, look what's on your neck. The bacterium produced by these deer ticks is this beautiful spirochete. Called Borrelia burgdorferi, and I am not good at pronunciations. What I find fascinating is the bacterium that causes Lyme disease spreads aggressively throughout the body, but little is known how it so effectively moves. In a paper published in Cell Reports, researchers from the University of Toronto show that the bacterium rapidly grabs and releases its host blood vessels, lining endothelial cells with a protein that acts like grappling hooks. Look at those grappling hooks. This mechanism is how the bacterium can overcome the fast flow of blood and avoid getting swept away. Here's our little friendly bacterium traveling through the bloodstream. He's using those grappling hooks to attach to the endothelium. It can invade a variety of cultured cells, including fibroblasts, lymphocytes, macrophages, karyocytes, and synovium, and most recently, neuronal and glial cells, by hiding in these cells during human infection. Chemical analysis of the external membrane of the burgdorferi revealed the presence of 46% proteins, 51% lipids, and 3% carbohydrates. In addition to a linear chromosome, the genome includes 21 plasmids, 19 linear, 9 circular, by far the largest number of plasmids found. This little guy is very slow growing with a doubling time of 12 to 18 hours. He is a microaerophilic organism, which requires little oxygen to survive. Because of his double membrane envelope, he is often mistakenly described as gram-negative. When we become infected with pathogens from tuberculosis to yeast infection, the liver produces hepcidin, a hormone that inhibits iron from being absorbed in the gut and also prevents it from getting into the bloodstream. We become anemic, which is one reason we feel terrible, but it effectively starves pathogens of iron they need to grow and survive. Well, scientists have confirmed, unlike any other known organism, this little guy can exist without iron, a metal that all other life needs to make proteins and enzymes. Instead of iron, the bacterium substitute manganese to make the essential enzyme, thus eluding the immune system defenses that protect the body by starving pathogens of iron. Superoxide dismutase protects the pathogens against a second defense mechanism that the body throws against them. The body bombards pathogens with superoxide radicals, highly reactive molecules that cause damage within the pathogens. Superoxide dismutase is like an antioxidant that neutralizes the superoxides so that the pathogen can continue to grow. This is Dr. Dawson, and I wanted to ask you, what do you know about Lyme disease?
Well, I know that it is actually caused by a infectious agent that is carried by a particular species of tick, and I believe it's the deer tick, but I'm not positive on that, and that if not treated fairly quickly after diagnosis, it can lead to a lot of lifelong, potentially debilitating side effects like arthritis and a wide variety of other problems.
This is Dr. Maroofi. He's a neurologist here in Blacksburg, Virginia. And a couple questions for you about Lyme disease. First of all, what's the most effective titer to test, a blood test to test for Lyme disease in a patient?
Effective will be the Lyme titer PCR, where they will detect the actual particles of the bacteria, and that will be the only way to be certain that you have the particles of the bacteria active. There is another way that you can get cultures, but those take usually extra weeks or even several weeks for them to grow. So practical, they are not too practical.
And if it's not active, can you tell if there was an exposure but currently not active?
Yes. There is other.
On the same test?
There are other tests that can tell you if you were exposed to, and if the exposure was recent or it was like remote in the past. So if it's recent exposure, then you assume that it's active. If it's in the past, then that's where the ELISA and Western blot comes. That to help is just those are just measuring the antibodies that you have against the Lymes. So if it's in the past, it's something that is either chronic, active chronic, mean for months but still having the problem, or something that you had in the past and is treated and is not there.
It was treated by your own body?
It could be, you probably could have treated, yes, or that you got treatment by medication.
And so if you have it in the past, you don't treat that?
If you have it in the past and you don't have any symptoms of anything, then there is really not much of a point to treat.
Okay. When they have a tick bite, the onset of that to symptoms, usually how long is that?
Usually will take weeks to even months, but weeks is the average, I would say.
What's the most common misdiagnosis for Lyme disease?
Lyme is one of these conditions are the great mimickers, I would say. It can present in so many different ways. The most common is going to be stroke-like type of situations, multiple sclerosis type of situations, abnormal, well, the diagnosis is so difficult, so the most common I would say neuropathy, polyneuropathy, but it can present on very different ways. Patients with abnormal eye movements, with stroke-like symptoms, with areas of numbness, weakness, pain, inflammation of the brachial plexus, or the lumbar plexus, weakness. So the presentation is very different from one patient to the other.
What's the preferred antibiotics to treat it?
The most common is going to be doxycycline, and that's just for the conventional Lyme disease, and then you take the antibiotic for two weeks.
Oral or IV?
Oral. When you go into neuroborreliosis, if it goes into brain, that you confirm that with spinal fluid, then you will require IV antibiotic, and that goes for 3 weeks, and the preferred is Rocephin or ceftriaxone.
Okay. Is it always effective treating with antibiotics?
There's not one. There is very rare to say always effective. You know, there is always the case that is resistant, or it was patient is having other problems. What I will say is very effective, the Rocephin. When we don't give Rocephin, it's because patient is allergic to Rocephin for any other reason and cannot take it, and there are some other antibiotics that we get the infectious disease specialists involved to choose which one will be the most appropriate.
Is there a stage with which it is irreversible?
Yes, I mean there are depends of the part of the brain or the nervous system that got involved. If you say, for example, the patient actually presents with some sort of a myelitis that was let go for a long time, and there was a strong inflammatory process that caused a lot of damage to the spinal cord. If there was like severe destruction of the axons and all the connections within the spinal cord, I mean, you can talk about permanent nerve damage there. But if it's just early stages, or just swelling of the nerves or the fibers or the meninges, you can treat without leading to permanent nerve damage.
So it can cross the blood-brain barrier?
Yes.
Do you know how?
Through the blood-brain barrier.
Okay. All right. I think that's it.